Colonoscopy has two main purposes. One purpose is to check on certain symptoms or conditions that your doctor would be concerned about. The second purpose is to screen your colon for colorectal cancer. A colonoscopy can be used to see problems in the colon in patients who have a variety of serious symptoms. Some of these symptoms can include chronic diarrhea or unexplained changes in your bowel habits, bleeding from your rectum or anus, unexpected weight loss, iron deficiency anemia, or other symptoms. If you show signs of any of these symptoms, you should talk to your doctor. Colorectal cancer is one of the leading causes of death in the U.S. Colonoscopies have proven to significantly decrease the incidence of colorectal cancer. If the lining of your colon contains polyps, there is a chance that these small growths of tissue can turn into cancer. A colonoscopy makes it very easy for your doctor to find and remove these polyps early on before they have a chance to become cancer. During your colonoscopy, your doctor will be able to remove polyps easily using specialized tools. These tools operate by cutting off polyps from the lining of the colon wall and removing them safely. Removal of polyps is painless since there are no nerves in the lining of the colon. After a polyp is removed from your colon, it is sent to a lab for analysis by a trained doctor, called a pathologist. The lab results are very important as they will inform you about whether the tissue sample is benign, i.e., not cancerous, or precancerous. If the tissue sample is precancerous, you will need to meet with your doctor again. There are two main categories of patient risk: average risk and increased risk. It is very important for you to understand which category of risk you belong to. If you are a healthy male or female, age 50 or older, you are considered to be an average risk patient. In this category, it is recommended that you get a screening colonoscopy when you turn 50, since 90% of colon cancers occur after this age. If the results from your previous colonoscopy return normal, your next one can be done in another 10 years. As long as no abnormal results are found along the way, the same schedule can be followed up until you are 75 years old. A screening colonoscopy is the most useful test for the detection of colon cancer. However, your doctor may suggest a different test for you depending on your own medical circumstance. These other tests can be divided into three groups: stool-based, direct visualization, and radiological. Stool-based tests include the guaiac-based fecal occult blood test, GFOBT, fecal immunochemical test, FIT, and stool DNA test. Other test options include a flexible sigmoidoscopy, which is an example of a direct visualization test. A computed tomographic colonoscopy is an example of a radiological test. It is important to know that you will be asked to have a complete colonoscopy if any of these other tests are positive for cancer. If you are in the group of patients considered to have an increased risk of colon cancer, it is suggested that you get a screening colonoscopy before you reach 50 years old. If you are a patient who has an increased risk, you may need a colonoscopy more often than patients who are in the average risk group. Whichever group you belong to, a colonoscopy is a procedure that should be done several times over your lifetime because polyps can reappear. Depending on the types of polyps found in your colon, some types have a higher chance of turning into cancer than others. Hyperplastic polyps are a benign type of polyp, which means that they have very little chance of turning into cancer. However, they still need to be removed and examined under the microscope, which will determine if these polyps are hyperplastic. Even if you have hyperplastic polyps, it is still very important to have a colonoscopy every 10 years. Unlike hyperplastic polyps, adenomas are a type of polyp that have the potential to become cancer. If adenomas are found based on your colonoscopy results, you will be asked to have additional screenings done at shorter intervals of time, depending on the size and number of adenomas found. If you have had colon cancer before, it is important to tell your doctor since you will have a higher risk of getting colon cancer again. After colon cancer treatment, your doctor may recommend that you get another colonoscopy. Having a family history of colon cancer or adenoma-type polyps before you are 60 years old means that you will need a colonoscopy sooner than the typical age. You may also be asked to have a colonoscopy earlier than the average risk person if at least 2 first-degree relatives, i.e., parents, full siblings, or children, or second-degree relatives, i.e., grandparents, grandchildren, uncles, aunts, nephews, or half-siblings, have had colon cancer at any age. In these cases, screening may begin at 40 years of age, or as early as 10 years younger than when the family member was diagnosed, whichever happens first. Certain conditions can lead you to have a higher risk of colorectal cancer. These can include Lynch syndrome, which is an inherited genetic condition that leads to an 80% risk of colon cancer over your lifetime. Inflammatory bowel disease, IBD, involving the colon and primary sclerosing cholangitis, PSC, are other diseases that can increase your risk of colon cancer. If you have both IBD and PSC, you have about a 30-fold higher risk of developing colon cancer. Colonoscopy is a powerful tool that your doctor can use to greatly reduce and prevent your risk of colon cancer. Talk to your doctor today about booking your colonoscopy.
Colorectal cancer, often called bowel cancer, is a silent but deadly disease. It's the third most common cancer globally and the second leading cause of cancer-related deaths. About 10% of all cancer deaths are due to colorectal cancer. These alarming statistics underline the importance of recognizing the warning signs and understanding prevention strategies to protect yourself and your loved ones. In this part, we'll focus on the 7 critical warning signs that may indicate colorectal cancer. These symptoms are your body's way of telling you that something might be wrong. Recognizing them early can lead to timely medical intervention, significantly increasing the chances of successful treatment. Have you noticed a shift in your bowel habits? Perhaps you're visiting the toilet more frequently than usual, or maybe less often. Some people defecate daily, while others might go a few times a week. Any noticeable change in your usual pattern could be a sign to pay attention to. Colorectal cancer often presents as alternating diarrhea and constipation. You might experience loose stools for a few days, followed by constipation, and then the cycle repeats. Stools may also change in consistency, color, or shape. For example, ribbon-like stools could indicate a tumor partially blocking the colon. While occasional bowel habit changes are normal, persistent or worsening changes warrant a visit to your doctor. Studies show that 65% of colorectal cancer patients report altered bowel habits, making it one of the most common early symptoms. One of the most concerning signs of colorectal cancer is blood in the stool. This symptom often goes unnoticed or gets misattributed to less severe conditions like hemorrhoids. However, ignoring it can be dangerous. The type and appearance of blood can vary depending on the tumor's location. Black tarry stools may indicate bleeding from the right side of the colon, known as the ascending colon. This is known as melena and is caused by digested blood, which has a foul smell. Bright red blood on toilet paper or dripping into the toilet is more common with tumors on the left side of the colon, which includes the descending or sigmoid colon. Other causes, such as hemorrhoids or anal fissures, can result in blood in the stool, but you should never assume. If you notice persistent bleeding, consult your doctor immediately for evaluation. Early detection can save your life. New or unusual abdominal pain can be another red flag. If you're experiencing severe cramps, recurring pain, or discomfort while defecating, don't ignore it. These symptoms might indicate a tumor causing a partial or complete blockage in your colon. While gas, dietary changes, or stress can lead to abdominal discomfort, persistent pain that doesn't subside with lifestyle adjustments should be investigated. Tumors can obstruct bowel movements, causing bloating, gas buildup, and sharp pains. Feeling tired occasionally is normal, but prolonged fatigue lasting weeks or months may be a warning sign. Colorectal cancer-related fatigue often stems from anemia, caused by slow, chronic bleeding from the tumor. This hidden blood loss depletes your body's iron stores, leading to weakness and exhaustion. In some cases, cancer cells use up large amounts of energy to divide rapidly, further contributing to fatigue. If you're eating well, getting enough sleep, and still feeling unusually tired, it's essential to check with your doctor. Persistent bloating or swelling in your abdomen can indicate a tumor blocking the bowel, causing a buildup of gas and stool. This symptom often coincides with abdominal pain and may cause you to feel full even after eating small amounts. Bloating can result from many benign conditions, but frequent or severe episodes warrant medical attention. It's better to be cautious and rule out serious causes like colorectal cancer. Unintentional weight loss is a significant symptom of many cancers, including colorectal cancer. If you've lost weight without changing your diet, exercise routine, or lifestyle, it's a sign that something could be wrong. Colorectal cancer can lead to weight loss for several reasons. Tumors can obstruct nutrient absorption, depriving your body of essential calories. Cancer cells release substances like cytokines that suppress appetite. The increased energy demands of cancer cells can lead to muscle and fat loss. If you've lost weight suddenly and can't pinpoint a reason, schedule a medical checkup to investigate further. Have you ever felt like you didn't fully empty your bowels even after a bowel movement? This uncomfortable sensation called tenesmus is a common symptom of colorectal cancer. Tumors in the rectum or sigmoid colon can create a partial blockage, making it feel like there's more stool to evacuate. Tenesmus can also cause changes in stool shape, such as thin, ribbon-like stools as feces squeeze past the tumor. If you experience this symptom frequently, it's crucial to seek medical advice. While these symptoms are common warning signs of colorectal cancer, it's important to note that many people with early-stage colorectal cancer don't exhibit noticeable symptoms. That's why regular screenings and being proactive about your health are vital. If you notice one or more of these symptoms, don't panic. They don't automatically mean you have colorectal cancer. However, it's essential to consult a doctor for a proper diagnosis. Many of these symptoms can also be caused by benign conditions like irritable bowel syndrome, IBS, or inflammatory bowel disease, IBD. Early detection through screenings like colonoscopies or stool tests significantly improves the chances of successful treatment. In the next section, we'll dive deeper into prevention strategies and discuss lifestyle changes, dietary habits, and risk factors you can manage to lower your chances of developing colorectal cancer. Understanding the warning signs of colorectal cancer is crucial, but prevention is even more powerful. While some risk factors like age or genetics are beyond our control, many lifestyle changes and habits can significantly reduce your risk. In this part, we'll explore actionable prevention strategies, discuss why colorectal cancer is increasing in younger populations, and uncover ways to protect yourself. Colorectal cancer was once considered a disease primarily affecting older adults. However, in recent years, the number of cases in people under 50 has been steadily increasing. Why is this happening? Here are some contributing factors. Dietary changes. The rise in processed and ultra-processed foods is a significant culprit. Diets high in processed meats like bacon, sausage, and deli meats, combined with low intake of fruits, vegetables, and whole grains, increase the risk of colorectal cancer. These foods are often low in fiber and packed with harmful preservatives and chemicals. Sedentary lifestyles. Modern lifestyles involve less physical activity and more time spent sitting. A lack of exercise can lead to obesity, insulin resistance, and inflammation, all of which increase cancer risk. Obesity epidemic. Obesity has become a global health crisis and a major risk factor for colorectal cancer. Excess body fat alters hormone levels, promotes chronic inflammation, and impacts gut health, creating a fertile ground for cancer development. Environmental and lifestyle factors. Increased exposure to environmental toxins and stress, combined with poor sleep habits and excessive screen time, contribute to overall health deterioration. The American Cancer Society has recognized this alarming trend, lowering the recommended age for colorectal cancer screenings from 50 to 45 for average-risk individuals. For those with a family history or additional risk factors, screenings may need to start even earlier. Here are 7 proven strategies to reduce your risk of colorectal cancer. The last one is especially vital. Stay tuned. 1. Eat a fiber-rich diet. Fiber is your gut's best friend. It helps maintain healthy bowel movements, reduces the time stool spends in the colon, and supports a balanced gut microbiota. High-fiber diets have been shown to lower the risk of colorectal cancer significantly. Include fiber-rich foods like fruits, vegetables, whole grains, legumes, and nuts in your diet. Aim for at least 25 to 30 grams of fiber daily. These foods not only improve digestion but also help regulate weight and blood sugar levels, both of which are critical for cancer prevention. 2. Limit processed and red meats. While red meat can be part of a healthy diet, excessive consumption increases the risk of colorectal cancer. Processed meats in particular are classified as Group 1 carcinogens by the World Health Organization. Opt for lean protein sources like poultry, fish, beans, and tofu. Limit red meat to no more than 18 ounces per week and avoid processed meats altogether when possible. By reducing these foods, you lower your exposure to harmful compounds like nitrates and heterocyclic amines, which can damage the lining of your colon. 3. Stay physically active. Exercise is one of the most effective ways to protect your colon. Regular physical activity improves bowel function, reduces inflammation, and helps maintain a healthy weight. Aim for at least 150 minutes of moderate exercise or 75 minutes of vigorous exercise per week. Incorporate a mix of aerobic activities like walking or swimming and strength training for maximum benefit. Staying active not only lowers cancer risk but also boosts energy levels and overall well-being. 4. Maintain a healthy weight. Obesity is a major risk factor for colorectal cancer. Excess fat promotes the production of hormones like insulin and estrogen, which can fuel cancer growth. Chronic inflammation associated with obesity further compounds the risk. Focus on a balanced diet rich in whole foods. Avoid crash diets or extreme weight loss measures. Combine healthy eating with regular exercise for sustainable weight management. Even losing a small percentage of body weight can have a significant impact on your health. 5. Avoid smoking and excessive alcohol consumption. Smoking and alcohol are two of the most significant preventable causes of colorectal cancer. Tobacco use introduces carcinogens into your body, while alcohol increases the risk of cancer in the digestive tract. If you smoke, seek help to quit. Limit alcohol to no more than 1 drink per day for women and 2 drinks per day for men. Quitting smoking and moderating alcohol intake can dramatically reduce your cancer risk and improve your overall health. 6. Stay hydrated. Drinking enough water is essential for maintaining healthy digestion and preventing constipation. Proper hydration helps flush toxins from your system and supports smooth bowel movements. Aim for at least 8 to 10 cups of water daily. Avoid sugary or caffeinated drinks, which can dehydrate you. Staying hydrated also enhances the effectiveness of a high-fiber diet, as water and fiber work together to improve bowel health. 7. Get regular screenings. This is the most critical step in colorectal cancer prevention. Early detection is key to catching precancerous polyps before they develop into cancer. Stool tests, fecal occult blood tests or fecal immunochemical tests can detect hidden blood in your stool, a potential sign of polyps or cancer. Colonoscopy. This procedure allows doctors to examine your colon and remove polyps during the same session, preventing them from becoming cancerous. Screenings should begin at age 45 for most people, but those with a family history or other risk factors may need to start earlier. Talk to your doctor about the best screening plan for you. Certain foods have natural anti-inflammatory and antioxidant properties that can protect against cancer. Turmeric contains curcumin, a compound with powerful anti-cancer properties. Green tea, rich in antioxidants that support gut health and reduce inflammation. Garlic and onions, high in sulfur compounds that may help prevent cancer. Dairy products. Research suggests that calcium-rich foods like milk, yogurt, and cheese may reduce colorectal cancer risk. Incorporating these foods into your diet can provide added protection and enhance your overall health. Prevention is always better than cure, and colorectal cancer is no exception. By adopting these habits, you're not just lowering your cancer risk, you're improving your overall quality of life.